This is Mr. Johnson from Ohio for 5 minutes.
Well, thank you, Chairman Guthrie. I appreciate it for this very important hearing. You know, it's with the power of hindsight that we're here today talking about how we can be better prepared for the next disaster, be it a hurricane, a tornado, or another pandemic. The last time the Energy and Commerce Committee looked at the Pandemic and All Hazards Preparedness Act, it was 2018. And nobody in this room now or then could have predicted what was to come, COVID-19. Now that we have the coronavirus squarely in our rearview mirror, we must take lessons learned. We got to consider what those are, both good and bad, and ensure that we're in a stronger position to fight the next natural disaster or health crisis. But if there's one silver lining, it's the National Disaster Medical System, NDMS, or as I like to think of them as the National Guard of medical professionals. When disaster strikes and the need for urgent medical care is required, the men and women of NDMS are called to action. And it's easy to forget that disaster response personnel from NDMS respond to all kinds of disasters, not just pandemics. For example, just last month, those volunteer medical professionals were dispatched to Guam in response to a typhoon that hit the island. Over 45 NDMS Health and Medical Task Force and Incident Management Team personnel were deployed to support emergency response efforts and ease the burden on local health systems, inevitably saving lives. The NDMS represents a network of intermittent federal employees who are medical professionals serving within their communities while jumping into action to serve our nation by deploying during natural or man-made disasters. In their everyday life, they're the doctors and nurses each of us see in our local health systems in our communities. Under the last reauthorization, Congress provided direct hiring authority to the Administration for Strategic Preparedness and Response for the NDMS workforce through September 2021. To allow for the most flexibility during COVID-19 and to combat the dire workforce needs, we've continuously extended this authority through one-off must-pass bills since then. Jumping from short-term extension to short-term extension is not sustainable. We need some certainty, and it hurts their overarching recruitment and retainment efforts. So it's for these reasons Representative Schreier and I have introduced the Doctors at the Ready Act, which will provide for stability and certainty at ASPR to ensure this program has the flexibility needed to provide for a properly staffed NDMS in the case of an emergency. So question number one goes to Dr. Parker. You know, Dr. Parker, like you, I served for 26 years in the United States military, in the Air Force. So thank you first and foremost for your service to our country. But based on your experience as Principal Deputy Assistant Secretary for Preparedness and Response, could you further elaborate on the challenges posed by this intermittent hiring cycle and its impact on the continuity of our preparedness and response framework and operations? The legislation that Representative Schreier and I have introduced would eliminate the sunset permanently, thereby providing more stability and flexibility for the program. The goal would be to ensure we have civil servants ready to deploy when we need them. So can you respond to that, the challenges?
Sure, and thank you for the question and for your, and I commend you for the bill to do this, to strengthen NDMS. It's absolutely essential that we do that. The NDMS, what makes NDMS work is the people, is the health professions across our United States that are volunteering to become intermittent and civil servants to deploy to help our nation in need. So this is needed, and I would commend any other things that would strengthen NDMS. NDMS is a unique national asset that the public is not aware of. We need to strengthen it. We need to think about what does NDMS 2.0 look like.
Okay. Do you think it's going to help? I mean, is it going to have the impact that we're hoping it does, particularly around recruitment?
Anything you can do to make it more long-term and to incentivize the volunteers of our health professions to sign up and participate will be helpful. I think we need to think about what are other incentives, and I don't know what they are right now off the top of my head, but we need to think about other incentives as well to make sure that we have a robust, diverse workforce that will volunteer for NDMS service in the future.
All right, well, great. Well, thank you very much, and Mr. Chairman. I urge support for H.R. 3613, the Doctors at the Ready Act. And with that, I yield back. Thank
The
you.
gentleman yields back, and the chair recognizes